We'll discuss the management of ovarian hyperstimulation syndrome. This is the management of ovarian hyperstimulation syndrome. This is the RCOG Guidelines 2016. Okay. Basically, this is the management of OHSS. What are the recommendations of RCOG GTG 2016? Okay. So we'll discuss that part today. Basically, the OHSS is the complications of fertility treatments which usually use pharmacological ovarian stimulation. That is the number of oocyte stimulation during a IVF cycles. The ART technology. This is the basic cause of OHSS. So the basic pathophysiology of the ovarian hyperstimulation syndrome is HCG and LH and your FSH. Very important. You can see this is the HCG and FSH and LH. Okay, HCG that will cause a pro-inflammatory mediator that will release vascular endothelial growth factors that will cause an ovarian enlargement and that will cause increased vascular permeability, that is cause ascites, pleural effusions and the pericardial effusion, that is the third space collections, and the prothrombotic effects will lead to OHS, ovarian hyperstimulation syndrome. The incidence, everybody know, basically the IVF cycles, all these different fertility treatment, ovarian hyperstimulation syndrome is happening. Okay, the next is how to diagnose. Basically, you have to get relevant history for a woman who is suffering from OHS. Basically the time of onset of symptoms related to the triggering agent, medication like HCG, genus agonist, follicular monitoring scan, the last number of egg collected, and the embryo replace how many days, polycystic ovarian diagnosis. Symptoms wise, you can ask abdominal bloating, discomfort, pain, need of analgesia, nausea, vomiting, breathlessness, inability to fly flat or talk in full sentences, reduced urinary output, leg swelling, bulbar swelling, associated comorbid like thrombosis. The general examinations for dehydration, edema, pedal edema, bulbar edema, sacral edema, record heart rate, respiratory rate, blood pressure, body weight. You have to assess the abdominal ascites, palpable mass, peritonism, measure gut, and yours. The in case of respiratory distress, you assess pleural effusion, pneumonia, pulmonary edema. Investigation like full blood count, hematocrit to soothe the hemoconcentration, because there will be a third phase collection that will cause dehydrations, that will cause hemoconcentration of the hematocrit level will significantly fall if there will be severe third phase collections. Full blood count, CBC, and hematocrit, C-reactive proteins to see the inflammatory condition status, urea electrolytes, because there will be a excess hyponatremia because of fluid loss, hyperkalemia. Serum osmolality also low because there will be a third collection, the osmotic quantity also less. Liver function test to see the reduced level of albumin, liver enzyme, HCG, coagulation profile, elevated fibrinogen, reduced antithrombin, HCG to do the treatments responding of the treatment. Ultrasound scan, you have to do those, look for the size of the pelvic abdominal fluid, consider ovarian Doppler if torsion is suspected. Other tests may be indicated like arterial blood gas, D-dimer, echocardiogram, chest X-ray, and CT venogram if these are the symptoms suspected. Okay. Then basically how we classify the mild OHS, moderate OHS, severe OHS, and critical OHS. Basically though, in the mild cases there will be usually mild to moderate is easily they will manage at a outpatient basis. These two will manage an OPD basis, but these two was managed at the inpatient management has to be done because there will be a risk of thromboembolism. So these are the patients how to diagnose mild basis, moderate, severe, critical. Mild is abdominal pain, is vomiting, mild abdominal pain. Ovarian size is less than 8 centimeter only. The moderate OHS, very important. The difference point is the ascite is started from the moderate OHS and the size of the ovarian size will increase 8 to 12 centimeters. Okay. Then there will be moderate abdominal pains, and in the severe cases, the severe things you have to know all this renal functions test. Oliguria, it is oliguria less than 300 ml day. Hematocrit is also more than 45%, hyponatremia, hyperkalemia, hyperosmolality, and hyperproteinemia, and ovarian sizes gradually increase to more than 12 centimeters. If it is more than okay. So 8 centimeter, less than 8 centimeter, mild, moderate 8 to 12 centimeters. Severe OHS, ascites started from the moderate cases. Severe OHS, mainly the hematocrit will be falls more, and the oliguria will be happens, and yours hyponatremia, hyperosmolality, and hyperkalemia, hypoproteinemia, ovarian sizes of more than 12 centimeters. Critical OHS, there will be the acid will be there, but there will be a tens. If you see any question, they will ask for tens ascites, then you have to mark as critical OHS. And hematocrit is 55%. So white blood cell count is more than 25,000. Oliguria or anuria, very important. Here is oliguria, but here you have to add anuria. And thromboembolism, ARDS symptoms. Okay. So these are the conditions I will If you go to the management part